Hi, thank you for joining us. We are presenting to you a webinar today addressing information and resources for businesses about that are available for businesses affected by COVID-19. So before we get started, we did want to address that this webinar is being broadcast and we will record this. This will go on to our YouTube playlist. This will be available after this session. We will be sending out the link to that YouTube channel after the webinar, and we will be sending the PDF to all registrants. If you want to ask questions, please type them into the questions box on the right hand of your screen, and we will address those. We'll do our best to address those at the end of the webinar, or we will follow up. I'd like to introduce the Cabinet Secretary for New Mexico Economic Development, and that is Alicia Keys.
Thank you, Joanna. Thanks for putting this together. This is an unprecedented time, and we know as business owners you have so many responsibilities. We've assembled a team of experts here from the state and federal agencies to talk about their resources and what they can do for businesses in New Mexico. We can't do this alone. This is very much a collaborative effort, so we really thank them for coming. We have Deputy Secretary John Clark on the line, Finance Division Director Mark Roper, Joanna Nelson, our business finance expert. These are all from EDD. From the governor's office, we have Daniel Schlegel, who is the small business advisor to Governor Michelle Lujan Grisham. We also have John Garcia, the district director of the U.S. Small Business Administration in New Mexico. We have our state agency partner, Bill McKinley, Secretary Bill McKinley, from the Department of Workforce Solutions, and we have Heidi Kraffel from the Department of Health, as well as Eric Chenier. I would like to point out that we had the capacity to have 1,000 people participate. We know that there are people that are unable to participate as it's already oversubscribed. We are trying to get in touch with GoToMeeting right now in order to see if we can have other people sign on. But as Joanna said, this will be recorded and it will be available on our website. So, as of today, the governor has authorized the Economic Development Division to implement 2 emergency initiatives. The first is the COVID-19 Business Loan Guarantee Program. This program works in partnership with a lender where the state provides a loan guarantee. The Economic Development Department helps guarantee a portion of a loan or a line of credit with a maximum participation of $50,000 or 80% of the principal. The loan can be used for any purpose, including working capital, inventory, or payroll. Lenders should submit the application to the Economic Development Department online through COVID-19 Business Loan Guarantee Program on the EDD website, and that is on the landing page, and you will see it right there. I will just want to stress, companies do not submit. This is your lender who submits to the Economic Development Department. So work with your lender, and those lenders can be banks, CDFIs, or credit unions. The second initiative, which has been authorized by the governor, allows the Economic Development Department to use our signature LEDA grant program to offer no-interest loans. LEDA money can be used for land, buildings, and infrastructure, including lease abatements and mortgage assistance. This assistance is available to manufacturing companies that receive at least half of their revenue from out of state. In rural New Mexico, in communities of less than 15,000, this loan is available as well to retail businesses. We have staff that is located throughout the state. These are our regional reps. I'm just seeing right now, this is the website to go to for lenders and borrowers. On our website is gonm.biz. and then you will see the link right there. You can also contact the emails that are listed below, and these will also be on our website and the phone numbers. So our regional reps will be taking the lead on any kind of LEDA grant program information. Joanna, if we can go ahead, do we have a slide for this? Christine Logan in Las Cruces in southern New Mexico, Susie Russell in Roswell and the central part of the state, Max Gruner in Bernalillo, Santa Fe, Valencia County, Peter Mitchell in Rio Arriba, Taos, and Los Alamos, and our new regional rep, Lorraine Riggles in San Juan, McKinley, Cibola, and Sandoval. I just want to stress that all of their telephone numbers are on the website for you to look at. We will keep also a resource page which has the resources for any federal programs, any updates from economic development on our website also, and that has assistance links for you. So please connect with us, sign up for email blasts, because this is going to be just a collaborative process that we all work on together. I would like to introduce now Secretary Bill McKinley of Workforce Solutions, who is going to talk through his programs and initiatives.
Thank you, Alicia. So, as Secretary Key said, this is Bill McKinley, the Workforce Solutions Secretary. Our department is in charge of running the unemployment program for the state of New Mexico. Starting at 8 o'clock in the morning on Monday, so right after the weekend, we are waiving work search requirements for anyone who is either having their job lost or having their hours reduced due to the COVID-19 situation. This could be because you're asked to quarantine. It could also be that I'm working at a restaurant or working at an event center or some other such thing where my hours are reduced or gone away. What we are going to ask is that people, when they submit a claim for unemployment, say, hey, look, the COVID-19 situation was the reason for my hours to be either taken away or reduced, and our people will be as flexible and work with you as possible to get you unemployment. So what does that mean? First off, there's a caveat. There is a week-long waiting period between the time that you apply versus the week that you are allowed to receive your check for benefits. That waiting week is built into the system and is something people should expect. Number two, the maximum you can get per week for unemployment is $461. That can extend for quite a long period of time. Like I said, we're waiving job search requirements. In regular unemployment policy, you've got to actually look for a job while you're on the program. What we're treating this situation as is a temporary job loss, where you are looking for the job that you had. And so we are allowing people to continue on this program for at the very least a 4-week period. That's our initial time frame for putting this into place. It can be extended if we see that effects are going to be going longer. The other caveat I would say is that if you are currently making money, if you're on paid time off, if you have administrative leave, if you're simply getting a salary and working from home, this program is not for you. This is really focused on hourly employees who lose their hours and have no other way of making money, and they want to make sure that they stay available should that job reopen again. For business owners out there, there is a situation that we call layoff aversion. And the way that works is that if you have let's say you have an employee who's making about $600 a week. Let's say you've got 8 folks that you've got and you were planning on laying off half of them. If you reduce their hours by half to $300 a week, they can make between that $300 and our maximum amount in unemployment. So for employers in this situation, if you can rearrange your hours, there's a chance that, there's a good chance, there's an opportunity for your employees to make at least a little of that money back with our unemployment services. And the details of that are on this website before you. The last thing I would say is that we are encouraging strongly people that apply for unemployment to do so online at jobs.state.nm.us. There is an 800 number available. Online is absolutely the best way. It will allow folks to be able to get taken care of quickly. They can recertify in that certification process 24 hours a day, 7 days a week. And just, Secretary Keys, if I may, something that we talked about with our staff yesterday are three things. We're asking people to be patient. This is something that none of us, I think, have dealt with before. We're asking people to be kind. Here in New Mexico, we're all neighbors. We're all part of one community. We should treat each other with kindness, and that we're all part of a team. We're all in this together, and we all have a role to play. And I think if we do those things, three things, we're going to get through this in the best way possible. Thank you.
Thank you, Thank you, Secretary McKinley. I just want to reiterate, I know we're throwing a lot of information at you right now. It is going to be online. We are recording this, so you can listen to it again. In addition to, if you have any questions, start typing them and sending them through to us, because we will answer questions at the end of this presentation. Next, we have the Department of Health with us, Deputy Secretary Eric Chenier, and also Heidi Kraffel is the Bureau Chief for the Environmental Health and Epidemiology at the State Department of Health.
And Alicia, sorry, I may have sent the wrong bio, but I'm actually, I was kind of in a hurry before I came here. I'm actually a Deputy Division of Programs, Director of Programs at the Epidemiology and Response Division.
Fantastic.
That was my favorite previous job, though, so.
Thank you both for being here. If you wouldn't mind giving an update, and then I know a lot of our questions have to do with the Department of Health, so we'll do those at the end of this presentation.
Thank you very much, Secretary Keys. I'll start off with a kind of a high-level summary, and then move on to Heidi, who I think will fill in some of the details, and then at the end she can answer any questions that anybody has. Kind of coming off of Secretary McCamley's comments that he made, I would add one more thing to the list that he had, and I would say everybody needs to try and do their best to stay calm, get your families to stay calm, and try not to panic. That's kind of DOH's number one message at this point that we want to get across to people. It does nobody any good to panic and be stressed out. So far, New Mexico has 10 cases of people who have contracted COVID-19. Those cases are in Socorro County, Bernalillo County, and Santa Fe County. As you know, a couple days ago, the World Health Organization announced COVID-19 as a pandemic. However, the department did not wait for this to be declared a pandemic and has been working since early January to monitor and plan for the virus. We have plans in place that we've been using for quite some time, and we've updated our plans as soon as this virus started coming out and we realized that this was a threat to New Mexico. We started updating our plans appropriately to respond to all the things that we know about COVID-19 at this point. The governor has also declared the pandemic a public health emergency to free up as many resources as possible. I believe yesterday or 2 days ago when they released funding, it was about $750,000. And there will probably, I'm assuming there may be more later on. The emergency declaration freed up state funding, and the federal government has also provided the state with an additional $5.8 million in funding. And if you're watching the news, we think that there may be more funding coming later. We're also expecting to receive our first allotment of personal protective equipment and other supplies from the Strategic National Stockpile early next week. And so those supplies will be distributed to healthcare workers and others. Those include those N95 masks that you've probably heard about. We'll be distributing that sometime early next week, hopefully. The governor also recently announced several actions she's taking to limit social interaction and implement social distancing. Since we do not have vaccines or any kind of treatment for COVID-19, the best way to limit spread is to keep people apart, keep people distanced from each other. So first, we are immediately ending all out-of-state travel for state employees. This is not everybody, just state employees. All of our non-essential state staff will begin telecommuting, and we are recommending that private sector do the same if they can and if it's feasible. We also issued a public health order canceling most gatherings of more than 100 people. We also recommend considering not going to church or being in other large gatherings of less than 100 people, especially if you are older or have chronic health conditions. We've set up a call-in number to answer questions related to COVID-19. The number is 1-855-600-3453. And also, on top of that, the governor announced another number for non-healthcare related issues. And we would like to ask people to send most of their questions to this other line because our line has been very busy and we're trying to staff up, but it's been getting a little bogged down. The other line is 1-833-551-0518. I'd also like to ask if you're planning to go on vacation and travel out of state, that you consider not going on your trip. I just canceled my vacation that I had planned, so a lot of people are having to cancel, and it's not fun, but we'll get through this. We're also working on policies to limit or eliminate visitors to DOH facilities and screen our direct care staff before they enter our buildings. People in our buildings are some of the most vulnerable people in the state, and they require the greatest measure of protection. And the state is also prepared to take additional actions if needed. And with that, that's all I had. I'll pass it over to Heidi Kraffel for further comment. Thank you.
Great, Heidi. Yeah, I'll take it away. You can see on right now it says Chris Emery. That's not me, but it's Bureau Chief for the Bureau of Health Emergency Management. He put these slides together. And so I'm going to probably update them as I go when I see there's a difference. So we can go to the next slide. So what we're going to talk about is information about epidemiology, some supply chain issues, and then what the non-pharmaceutical interventions are, such as surfaces, environmental cleaning, and then, of course, Eric Chenier just talked about that social distancing aspect, sick leave and telecommuting, the workforce continuity of operations plan, or the COOP, messaging and resources. So first, I just wanted to talk to you about coronaviruses in general. So there's more than one. And they're on the left-hand side in the green. Those are kind of common or mild. And you can see below the arrow the different combination of letters and numbers that probably no one will ever remember. And then when you go toward the right, those are uncommon and those are more serious. So for example, we've got COVID-19 in the middle, and we think that that's a case fatality rate of about 0.7 to 3.4%. So that means the percentage of people who would ultimately, unfortunately, end up dying. And then we also have some of the more serious ones that are uncommon, MERS. So that was recognized in 2012. It was in the Middle East and Saudi Arabia, caused 2,494 cases and 858 deaths. And then you can see there the case fatality rate is 34.4%. So that's quite more serious, 34% of people dying versus what we think COVID-19 is about 3.4%. But of course, we're still learning about that. And then another one is SARS, which people probably would recognize. And the case fatality rate there is 9.6%. So even coronavirus is thought to be less fatal than SARS. So how does the disease spread, and what are some of the clinical characteristics? So basically, the reproduction number is for every one infected individual, approximately 1 to 4 people are expected to become infected. So compare COVID-19, which we think is about 1.4 to 3.5, to measles, which would be 12 to 18. So for measles, for every one infected individual, approximately 12 to 18 are expected to become infected. So it spreads much more rapidly for measles than it does for COVID. The person-to-person spread So what happens is it's likely, and so we say likely because we're still learning about the disease, which I think everybody can appreciate. It's by droplet transmission between people less than 6 feet apart. So essentially sneezing. If you sneeze, those droplets go about 6 feet, or a maximum of 6 feet. And then spread, of course, is greatest during periods of severe symptoms where you're really shedding virus. The incubation period is thought to be about 5 to 6 days, but it could range anywhere from 2 to 14 days. So that's why you'll hear about Department of Health quarantining people for 14 days. We want to give the biggest window possible to ensure we wouldn't bring somebody back to work when they were still infectious. And then the symptoms are fever, cough, shortness of breath. So what's tough there is that, of course, that can cover other things too, like pneumonia, for example, that's not related to COVID-19. And the severity really ranges. So it can be very mild to severe. And, of course, as I mentioned before, it can result in death. But those that are higher risk of developing the disease, older adults, so this is what we're seeing in New Mexico as well as the rest of the United States, older adults, and then people with serious chronic conditions, heart disease, diabetes, lung disease. So those respiratory diseases, pre-existing conditions are going to potentially put them at more vulnerability. So what can you do to take, let's see here, I'm going to wait till next slide. Yeah, I'm not sure what's going on there. That's okay, we're good. So the steps you can take to prevent COVID-19, I think people may be getting tired of hearing this, but clean your hands often, at least 20 seconds. And if soap and water are not available, use a hand sanitizer that contains at least 60% alcohol. I think a lot of people are really focusing on the hand sanitizer, but washing your hands, that is a core public health thing, very basic. If you have soap and water, it's a great way to protect yourself. Avoid close contact with people who are sick. Distance yourself from others if COVID-19 is spreading in your community. So, there's the Department of Health website, and that is http://cv.nmhealth.org. That is the best source of information for what's going on in New Mexico, so please stay tuned to that. And protect others, so we need to be thinking about this spread. Stay home if you're sick. I know it's really tough. My daughter was sick this morning, and I wanted to stay home with her. My husband is staying home with her instead, fortunately. Cover coughs and sneeze. Throw those used tissues in the trash. Immediately wash your hands. This is a case where it's okay to be a little bit on the gonzo side of being a clean freak. Wear a face mask if you're sick. So I really want to stress that if you're sick, because sometimes what we're hearing about is people buying up face masks, and then there's not enough for healthcare providers, for example. We need to ensure that our healthcare providers have the supplies that they need. So only wear a face mask if you're sick, if you're sick. Clean and disinfect frequently touched surfaces, tables, doorknobs, light switches, etc. Okay, so one of the things that we've been talking about is supply chain, and the supply chain, that's specifically about PPE, which is personal protective equipment. And there was actually one issue that happened when the COVID-19 was spreading in China, which is some of the PPE had been contaminated. So it all has to be sterile, and so some of the packages had opened up and they were no longer sterile. So we first had a problem with contamination of some of the PPE. Then we next had a challenge with the availability. And of course, a lot of the PPE is actually made in China. And so because, of course, they were the first ones that were hit so hard, they were impacted, and then their system to continue to produce the PPE was impacted. So we have had issues there, but we are also working with the CDC, with other organizations, to be able to extend PPE that's expired. For example, there's new guidance that CDC has been put up about that. So what are some of the non-pharmaceutical interventions? Again, this is the surfaces routine cleaning. So this is very basic, but it's cleaning high-touch surfaces every day with regular cleaning supplies. So for the businesses out there, it'll be important for you to connect with your janitorial staff and to really kind of step this up just to kind of reduce the contamination on doorknobs, light switch panels, etc. Then there's the environmental cleaning and disinfection, clean dirty surfaces with detergent or soap and water prior to disinfecting, use diluted household bleach to disinfect surfaces, and with laundry, do not shake linens or other laundry. Launder using the warmest appropriate settings. That's again to kind of that's to kill the virus. Clean and disinfect laundry transport containers. And then we also have on screen the detailed cleaning and disinfection guidelines from CDC. And in general, CDC has a lot of good guidelines online. So I'm not going to go over these in any depth because I want to make sure that I'm giving other people a chance to go over their presentations. So here's some information about worker protection and cleaning training, OSHA standards. And then there is some workplace social distancing, discourage workers from sharing tools and equipment, and then in implementing staggered work shifts, downsizing operations, and then remote service delivery if possible. And then sick leave, staying at home. We want to actually actively encourage sick employees to stay home and advise them to call the hotline if they have COVID-19 symptoms, fever, cough, trouble breathing, and develop flexible sick leave policies. We've talked a little bit about that before, and separate sick employees and send them home, and then advise sick employees to practice respiratory etiquette and hand hygiene. And then we also talked about telecommuting. So the encourage employees to telecommute work from home if possible, and that's already been mentioned by Eric Chenier and also by others.
And I just want to reiterate, these slides will be available on our website directly following, as in addition to a recording of everything that we're doing here.
So some of the other non-pharmaceutical interventions, planning a workforce continuity of operations. So this is very important. It's basically to ensure that you have a plan for what happens if your employees become sick and can't come to work. Who are their backups? Who are the essential people? How are you going to cover essential business functions if you have a reduced workforce? Okay.
Sorry, we're having some technical problems with
it's kind of
forwarding the slides.
It sounds like it's kind of trying to just work on its own here. Let's see here. Hold on just a second and let me make sure that I am on the right slide. Okay, so the slide up that's now is potential mitigation activities according to the level of community transmission or impact of COVID-19 by setting. So this is what workplaces can do to prepare for COVID-19 if they have cases, or if the community is experiencing spread of COVID-19. So we're not in New Mexico, we're not currently at community spread, but we are getting more cases. And so I think it would just be important for employers to be familiar with these different categories. So to look at the preparedness phase as well as the minimal to moderate. Since we could be getting into minimal moderate soon, I suggest that you review those categories and make sure that you're prepared for that. Okay, and so I had mentioned the New Mexico Department of Health website before. It's listed up there as well as the hotline. Please only use that particular hotline for health-related questions for coronavirus because we are really getting overwhelmed and slammed, and we want to try to keep the people who really need it, who are sick, having symptoms, and have traveled to that line, as well as just basic coronavirus questions. And then there's also the CDC website as well as OSHA guidance on preparing workplaces for COVID-19.
And the number that Eric gave us before, the 833 number, what should that be used for?
So that should be used for all non-health related questions. So if it's about employment, if it's about schools, other things like that.
Okay, and that number once again is 833-551-0518. Okay, Heidi, thank you so much. We are going to throw it over to John Garcia, who is with the U.S. Small Business Association, and he's going to talk about the federal government's disaster loan program.
Thank you, Secretary Keyes. And again, I want to thank you for inviting the federal agency, the U.S. Small Business Administration, the New Mexico District Office to participate in this. Our concern, of course, as you just heard from the Department of Health, is making sure our citizens are kept healthy and safe, but for the SBA, we're concerned about making sure our small businesses continue to be healthy and safe. You know, we all say they're the backbone of the economy. We want to make sure that that backbone doesn't get paralyzed during this crisis. So with that, on behalf of the Administrator, Jovita Carranza, this week was signed into action a small business initiative that I'd like to articulate to our listening audience. The U.S. Small Business Administration is offering designated states and territories a low-interest federal disaster loans for working capital of small businesses that are currently suffering a substantial economic injury as a result of the COVID-19. And upon request received from the state governor, the SBA will issue under its own authority, which is unique because the administrator of the SBA will be able to sign under her own authority, as provided by the Coronavirus Preparedness and Response Supplemental Appropriation Act that was recently signed by the President, the Economic Injury Disaster Loan Declaration. I've got two slides I'd like to discuss. If I can go back to this, not this slide, the next slide first. Let me start with that, and then we'll go into that first slide. And this is kind of, you know, how does it work or what is it? What this new Economic Injury Disaster Loan Declaration does, it's a loan assistance program issued by the SBA that makes loans available to small businesses and private nonprofit organizations in designated areas of the state to help alleviate economic injury caused by the coronavirus. The SBA Office of Disaster Assistance will coordinate with states or territories. Their governor will submit the request for economic injury disaster loan assistance. Just to keep in mind, the SBA focuses on three major areas, and one is access to capital, technical counseling, and contracting. But a third element in there that we only hear about whenever there's a disaster like a flood or a tornado, and that's the SBA Disaster Relief Program. Under this now, we have an Economic Injury Disaster Loan Declaration that the governor will participate in and declare. Once the declaration is made for a designated area within a state, the information on the application process for Economic Injury Disaster Loan Assistance will be made available to all affected communities, as well as updated on our website. The website, again, is the sba.gov/disaster. Please take note of that site. Again, it's the sba.gov/disaster. I would ask everyone to check that site out. The other slide, which would be that first one we were going to show, if you go back to that first slide. The SBA Economic Injury Disaster Loans up to $2 million in assistance per small business, and it can provide vital economic support to small businesses to help overcome the temporary loss of revenue that they're currently experiencing, their loss in profit or loss in sales that they're currently experiencing. These loans may be used to pay fixed debt, payroll, accounts payable, and other bills that can't be paid because of the disaster impact. The interest rate is a 3.75% for small businesses without credit available elsewhere in the state, or businesses with credit available elsewhere that are not eligible. The interest rate also for nonprofits is 2.75%. The SBA offers loans with long-term repayment in order to keep payments affordable up to a maximum of 30 years. Terms are determined on a case-by-case basis based upon each borrower's ability to repay. So the SBA Economic Injury Disaster Loans are just one piece of the expanded focus of the federal government's coordinated response, coordinated with the state, and the SBA is strongly committed to providing the most effective and customer-focused response possible. Again, I want to thank everybody for listening, but I also want to highlight for some of the small business on the line to remember that there are 9 other loan programs that we work with our banking partners, our third-party lenders, or micro lenders, and that's the 7A program, a loan that offers up to $5 million. It's an all-inclusive loan program. There's the Express loan, up to $350,000 used for small business revolving lines of credit. There's a Community Advantage program, which is up to $250,000. And then, of course, the 504, that's for land acquisition or buildings, and microloans. A lot of times, small business right now needs a microloan. That's up to amount to $50,000. And then there are 4 SBA export loans to help small businesses in terms of exporting or working capital or international trade. Again, I just want to highlight a call-in number. It's 1-800-659-2955. If anyone has any questions, again, 1-800-659-2955, or an email address, it's all one word, disastercustomerservice@sba.gov. Again, disastercustomerservice@sba.gov. And again, I encourage you all to visit the sba.gov/disaster program. If there's any other questions, feel free to call the New Mexico District Office, and myself and my staff would be glad to assist anybody. Again, I want to thank Secretary Keys, Secretary McKinley for support, also the Governor's Office. Thank you for engaging us in this. I have with me, by the way, Rico Zanotti. He's our Public Information Officer, who's been taking a lead for us on this. And so, Rico, is there anything you want to add?
No, you covered it all, John. Thank you.
All right, thank you.
So next, we're going to have Daniel Schlegel, the Small Business Advisor with the Office of the Governor, and he's going to talk about how businesses in New Mexico can get us the information we need to tap into federal assistance.
Thank you, Secretary Keys, and thank you, John Garcia. So I'm just going to add on to what John just spoke about, the SBA's Loan Disaster Assistance Program. So we've been working closely with the Sacramento SBA office who administers this program. And the governor, in order to make these funds available, is required to demonstrate economic injury in certain parts of the state. We are planning to open this up to the entire state, so it would be every county. In order to do that, we need to identify businesses to submit a short worksheet that identifies their economic injury. And we are targeting 9 counties. Each county, if we get one county certified, the contiguous counties around it are also included in that. So if we get strategically 9 target counties, we can get all 33 counties in this state to be included in this program. So the ones we still have outstanding that we're trying to identify a business and get them the worksheet to fill out. It's quite easy to do. We're looking at Santa Fe County, Colfax, Quay County, Socorro, Chavez, Doña Ana, Grant, and San Juan or McKinley County. And we are working with county officials, the economic development departments, as well as other partners to identify those businesses. That just got started today. So hopefully we'll have that application out to SBA over the weekend or hopefully as early as Monday. Our timeline, we were told by SBA that application, once it's in, the decision should be turned around within the business week. So by next Friday is our target. And by that time, we will get all the information for how to apply out through SBA and our partners in the counties. That will be on the SBA's website, and there's an online portal for submitting your application for loans. And there's also, as John mentioned, the toll-free call-in line as well.
Can I add one more thing?
Yes, Secretary McKinley is going to add one more thing.
Yeah, thank you. Just want to let everybody know there's currently a bill going through Congress that will allow for some more resources. We don't know exactly what that means yet. There will almost definitely be some expanded unemployment benefits. We don't know if that means just more money for the regular program, if we can beef up the dollars. We'll have to figure that out when it's passed. There was also some proposals about paid sick leave. We don't know how realistic that is, but we will be in constant communication. I've already talked to Rob Black with ACI. and we'll be talking with him and hopefully using him as one of our points of contact when that comes down. Just for everyone to know, as soon as something gets passed, we'll get the details assimilated and figure out how we could administer it as soon as possible and let people know what that means. Thank you.
And if you opt into our email blasts, we can keep information from Workforce Solutions and from Economic Development and SBA regarding businesses. We can send that information out. So we are going to go to questions. These are questions that are being sent in, typed in, so we have a few to start off with. And some of this might be reiterating what we've already said, but I think it's important. The first one is for Workforce Solutions. If businesses have to close or reduce staffing, will there be help for employees who may not get paid?
Yes, that is what unemployment is. So if a business closes or if hours are reduced to where you're making below the $461 cap, an employee should feel free to put in a claim at jobs.state.nm.us for unemployment checks. Once again, that will wait. They'll have to wait a week, but they'll be able to get, if they're completely laid off, that $460 check, or if there is hours are reduced, they'll get the remainder between what they're getting and that $460 check.
Okay, the next one is for the Department of Health. How long does the state expect to put a moratorium on meetings? Do we think this will be behind us in 60 to 90 days?
I don't know, you know better on that. We're reviewing here to make sure we're giving everybody the right answer. We don't want to give the wrong answer.
Hold on for 2 seconds.
So I believe the original public health order was for 30 days. I'm reviewing right now to find that. Can you find it? And then we'll reassess later on and decide if, after the 30 days is up, we'll reassess and decide if we need to extend.
Okay, great. This one is, I think Daniel Schlegel will take this. Will there be any assistance for workers with children that don't have access to childcare?
Thank you, Secretary Keys. So we, especially since the schools are starting to be closed for a 3-week period starting on Monday, all public schools, we are working diligently to make sure that childcare is available for all families in the state. We are working closely with the federal government as well to streamline the approval process for licenses for child care centers, and also to increase hours at certain child care centers that tend to be part-time. We're trying to increase those to full-time so there's more access. So that is an ongoing situation, but we are working very diligently to make that a reality by Monday.
Great. This one is for the SBA. What is the forecast for small businesses that contract with the federal government? Will there be a government shutdown?
As of this time, we have not heard of a government shutdown, but I know that there's discussion taking place as we speak on the government's activity. I think if we can keep our small businesses active and healthy, we should continue to function. I hope we're not at that level yet, but we are also talking about going into a telework mode of all of our agencies. If we're given a green light to do that, we're prepared to all go in telework and continue to operate the SBA as we would in any disaster, as it happened in Katrina or any other disaster. SBA continued to operate at those local areas that were damaged by that disaster.
Great. We have another question for you online. Someone has noticed that New Mexico only lists drought assistance for SBA loans. Will this be updated for COVID-19? Also, can you elaborate on the condition that no other credit is available?
Sometimes some of these small businesses right now, as we know it, that are hurting are small mom and pop shop small businesses that need to continue. If they cannot secure a loan on their own from our bankers, micro lenders, third-party lenders, this is what this emergency economic injury disaster loan will work on. What we need to be working on also is with our banking partners on some of the clients that are affected that cannot continue to pay their current loan back. So we'll probably get back with you on that, Secretary Keys, to get a more definite answer on that. But once the declaration is approved, the sites will be listed on the computer working with the governor's office in the IT system, and we'll know what sites those are and how they qualify.
Okay, great. Danny Schlegel, will let you take this one. Valencia County is directly between Socorro and Albuquerque. So will that county be considered for disaster assistance?
Yes, so the answer is definitely yes. Our plan is to target all counties to be a COVID-19 disaster center. We are targeting certain counties that are those 9 counties that are touching all the other counties as well. So basically, it's going to cover the entire state by the time we're done.
A lot of questions regarding restaurants. I'm going to throw this over to Secretary McKinley. Any information that we have with regards to support for small business restaurants?
So from the unemployment sector, from our office, basically that our support all goes to workers. So once again, if you have to lay off an employee, they can apply for unemployment and be able to get that up to $460 a week after that 1-week waiting period. I should also point out that we are extending for 4 weeks this waiver. So our people are going to be as flexible and open as possible if people are laid off, if they say it's the COVID-19 thing. And that can be for, hey, no one's going to restaurants anymore. What we would encourage restaurant owners to do if they can is reduce hours and keep people employed, even if those hours are small. Once again, if the money that a worker makes weekly goes below the $460, they can apply for unemployment for the remainder of that amount, the difference of that amount. We call that layoff avoidance, and we'll be getting out very shortly the website, but you can go to it. It's jobs.state.nm.us. We encourage employers to work with their employees to see if they can schedule ways for keeping people working at least a little bit, and for us to help support that. That is our recommendation.
Secretary Keys, can I add to that?
Yes, please.
Just to add to what Secretary McKinley was also talking about, some restaurants that are impacted by this are, for example, the Gathering Nations is going to have a $24 million impact in the Albuquerque area. And there's other conferences that have been canceled. You may have a restaurant right across the street or a small business sandwich shop that normally caters to that type of audience. They're going to take a hit on this. So they would qualify. So once the area is designated by the governor and it falls within that territory, that area, the small business owner will be able to go online, fill out the application, provide their tax returns and all the other documentation. It's as if they were getting a loan, and they would qualify. We have a lot of companies that are importing and exporting products right now that they haven't had products sent to them in the last 2 months coming out of China. They're being impacted right now, small businesses. So what this will do will allow that small business owner to get online, and then the SBA, in cooperation with the governor's office, will do its due diligence to ensure that that company does qualify. But
Right.
It'll tie into what Mr. McKinley is talking about.
Thank you. And just to reiterate, Danny, what do businesses need to do to help the governor out in terms of getting this?
So it's pretty straightforward. We only actually need 9 companies in these targeted 9 counties to fill out a economic injury worksheet, and it's 1 page. It just shows that your revenue compared to last year has gone down at this time due to COVID-19 related issues. So we've already identified a few companies who are sending in this worksheet to us, and we are going to be working with our partners on the ground to identify several more in those target counties over the weekend. But if you are in one of those target counties and have a business and would like to provide that information in order to expedite this, I'll reiterate what the counties are still pending. We're looking at Santa Fe, Colfax, Quay, Socorro, Chavez, Doña Ana, Grant, and San Juan or McKinley County. These targeting these 9 counties again will allow us to cover the entire state for a disaster center.
Great. We're going to move over to the finance side. We have a question here. Will small businesses that have owners that are quarantined due to COVID illness have any priority or additional help with loans? What if the owners and or businesses don't have strong credit? Joanna?
Sure. So that is exactly what our new guarantee program is targeting. We want to support businesses that are trying to get loans to help with immediate costs like payroll, operating costs, that we're going to put priority on those businesses that are negatively affected by COVID-19. So to reiterate the process, you would go to a bank, a lender, a CDFI, a credit union, and work with that lender to apply to our program. This isn't a loan program, but they are going to apply with us. We guarantee the loan up to 80%, and we're working on the guidelines to show that you have been negatively impacted. But go to that landing page that's up on the screen right now, the COVID-19 response, and you'll be able to see more information about that guarantee program. And I do also want to highlight that by connecting with us, whether on social media, signing up for our email list, checking out this landing page, we're going to update it every day with partners, agencies that have identified special incentives and special assistance that they're providing at this time, including banks, including lenders. So we'll be working really hard to stay updated on that.
Anything you wanted to add?
Well, just to add to what you're saying, and with the SBA, we work very closely with our resource partners that we have. The Small Business Development Centers, there's 18 centers across the state. Our SCORE chapters, 3 major SCORE chapters, our Veteran Business Outreach Centers, as well as the 6 Women Business Centers. So we'll be briefing them on the economic injury disaster loan as we work closely with the governor's office. So there's a lot of partnershiping going on to assist small businesses, and there's a lot of solutions to assist them so that they continue to grow.
Danny Schlegel?
Thanks, Secretary. So I just want to be clear that we're talking about 2 different programs here. There's the SBA disaster loan, and Joanna was talking about the COVID-19 Biz Loan Guarantee Program. That's the one where you go to traditional lenders and the state will help guarantee the loan. So just want to be clear that we have 2 different programs.
Thank you. Thank you.
And the loan guarantee program is open now, right? It's ready.
And how long does it take, Joanna, to go through it?
We are going to try to get these turned around within 24 hours to get a response to the lender. The lender's process, of course, depends on them. But as we've heard, they're willing to work very quickly to get businesses the financing that they need.
And in terms of our LEADA grant program, I know Mark Roper couldn't get on because there were too many people, but do we have a timetable for the turnaround on those?
Right now, I know that they are working to be more flexible during this time.
We will let everybody know what the turnaround is on that, but we're here to help and we're here to move quickly. A few questions for Department of Health, and then we'll wrap up the call. This person has a staff member whose roommate tested positive. They sent home the staff member. Is that enough to have everyone work from home?
Okay, so say that again. So a staff member tested positive?
Had a roommate who tested positive.
Mm-hmm.
They sent home that staff member. Is that enough to have everyone work from home?
So I think that the person who's positive, as well as any contacts, need to work very closely with Epidemiology and Response Division. I'm not familiar with this specific case. They do a lot of contact tracing, and anybody who's had exposure, then they will make recommendations regarding if other people need to stay at home. So whoever was the positive case, they need to work very closely with Epidemiology and Response Division to ensure that they make them aware of who has been exposed to the positive case, and so that we can then assure that people are staying home as needed.
And I just wanted to add to that, she already touched on that a little bit, but anytime a positive case comes up, we're doing extensive investigations to trace down those any kind of contact that they've had, and so in most of these cases, we're able to make a recommendation as to whether somebody should go to work or self-isolate or whatever happens.
Absolutely.
Great. 2 more questions. One of our listeners is looking for recommendations for group fitness classes and personal training in terms of whether or not you should be going to the gym.
So I'll take that. My sister is a gerontologist with the Veterans Administration in Connecticut. This is Bill McKinley with Workforce Solutions. She's also a gold medal winner from the United States Ultimate Frisbee team. Her recommendation was probably not. She said that it's a place where everybody gets together. There's a lot of touching going on. She said if you do want to go to the gym, it's important that you clean fairly deeply the equipment you're using before you get on there, specifically the places where your hand is going to be. But she said if there's a way to work out from home, specifically because of all the sweat and everything, that might not be a good idea. I don't know if DOH has anything else. That's kind of anecdotal, but that's what she has recommended.
DOH has not made any specific recommendations on gyms, but gyms do seem like a place where germs spread quite easily and freely through people's sweat, and it might be a good idea to stay away.
And especially for those people who are in the more vulnerable populations, older folks who have comorbid conditions, lung disease, respiratory problems, et cetera. It's probably not a good idea.
Okay, last question. How does one get a test kit without exposing others?
Okay, so let me explain a little bit about the test kit process. So right now, there's two ways to get tested. The first way is if you have symptoms and if you've been to one of the areas in the country that the level 2 or level 3 areas, and you call the 1-800 number, and then you talk to the epidemiologist, and they say, we want to get you tested. Then they will connect with SLD to get that test analyzed. But your provider will figure out where you need to get swabbed. So that's where they do a swab in your nose or throat, and they will figure out where you get swabbed. You get swabbed, and then that test goes on. I don't know if that answers the person's question or not.
Okay. So we are going to go ahead and wrap this webinar up. We just want to emphasize and say that this is just the beginning of a discussion. We hope that this was helpful. Those people that were registered will get an email, and we want to hear from you. If there's any way we can help out your business, let us know. Be as specific as possible. We are here to help, and everyone stay safe.
Thank you.
Thank you.
Good job. Ma'am, thank you.
Thank you. I won't.